So I talked to my gynecologist today, and the first question she asked is, "Are you still on the birth control?" I said, "No, I'm not. I couldn't handle the idea of putting extra estrogen in my body. Oh, and by the way, I'm trans." And she's actually had some trans clients before in the past. Um, and the reason that I want to be on Depo, which is this medicine right here, it's depo-provera, and it slows down the frequency of your periods, often to the point of completely shutting them off. As I've had long-standing and severe periods, like 7-8 days long, with heavy bleeding and intense cramping. When I describe them to other women who have periods, um, and other men who have periods, they look at me like, wow, that's a pretty intense period. You know, their experiences are not the same as mine. And so, you know, I'm aware that my cycles are much heavier than other people's cycles. And so we're talking and we're talking, and she goes, "Yes, of course, I'll go ahead and put you on the Depo. It sounds like a good idea because this is a progesterone-only medicine. It's not an estrogen medicine, and so it's less likely to interfere when I do go on testosterone, and it should shut down the cycles. And those are what I'm looking for." And because of my long-standing history, this is rubbing alcohol here. Because of my long-standing history with the painful cycles and things like that, it actually got so bad that they did an exploratory surgery to make sure that there wasn't other things going on. And no, it's just me. It's just my cycle and just my body, the way it's set up. I just am naturally painful there. And so she goes, "Have you ever thought about, you know, having those parts removed, your tubes, your ovaries, your uterus?" And I was shocked because this is the first time I've mentioned being trans. And she goes, "I think we can get your insurance to cover it. Like, you have a long history, greater than 10 years, of having pain with these organs, and it would be legit. Your insurance should cover this." So, you know, obviously it won't be today and it won't be tomorrow, but, you know, sometime maybe in the next 5 years, maybe the next 2 years, maybe the next year, I don't know. I should be able to get my insurance to cover my hysterectomy. And that's an amazing thought. So this is what the medicine looks like. It's like a white viscous substance. I don't know how well you can see it. It's kind of thick and cloudy. You wouldn't be giving this to yourself if you did have it. You'd be getting it administered at the doctor's office. The only reason I get it is because I'm a nurse, and I'm allowed to give my own injections at home all the time. So I'm going to bring my leg up here so you can see. Rubbing alcohol. Deep in the thigh. And there it goes. It's always weird to me when you have to inject something that's cloudy. It always freaks me out just a little. Needle guard. It's all locked up now. You can't get to the needle, can't poke yourself. And it's not even bleeding. So, that's my medicine, and that's my excitement of the day. I think that I can get my hysterectomy covered by my insurance. My very, very Catholic insurance that won't even pay for this medicine right here is going to pay for half of my transition surgery. And it's a big screw to the company that I work for that won't let me come out at my job, and won't buy me hormonal regulation medications, but they're damn sure going to pay for me to get my parts taken out, and that's awesome. Additionally, I love my gynecologist. And I'm going to put her up on the MTQI website, so that way you guys can find her, because she's a good one. So, Cincinnati, if you need more information, contact me, contact the MTQI website, and it's awesome. Have a great day, you guys.